Hi guys, I'm Dr. Madeleine Herman. If your child needs ear tubes, you may be asking yourself, what am I supposed to do? What do I expect before surgery and what do I expect after surgery? Well, I'm here to help you figure that out. So ear tubes are tiny little cylinders. They're about 1.5 millimeters in size that go into your child's eardrum. Those cylinders allow for the passage of fluid out of the ear and air to go into the ear. That decreases the frequency of infections and makes them easier to treat should you get another infection. It also allows fluid to drain out so that your child can hear better and their speech can develop a little easier. Before your child's surgery, we're not going to want them to eat or drink anything after midnight the night before the procedure. And the reason for that is for safety. When we give them medications to relax them during surgery, that also relaxes the muscles around their esophagus, keeping food and beverage from coming up into their airway. So we tend to recommend not eating or drinking anything after midnight. However, luckily your surgery should be first thing in the morning, and the surgery is so soon, so quick, so they should be able to tolerate it pretty well. When you arrive to the hospital, you're going to meet your surgical team. You'll see me as well as the anesthesiologist and the nurses that are helping your child back in the operating room. After you meet them and we talk about their history, we give them a good listen and take a whole bunch of vitals, make sure that they're nice and healthy. We'll carry them back to the operating room. While they're back there, most kids are happy and curious. We show them the little balloon that they're going to be breathing into. But luckily there's no IVs, no tubes in their throats. So we just go on back. They get a little bit of something kind of like laughing gas and they fall asleep gently. Most kids are more interested in looking at the instruments around them or watching the videos that we show them or playing with the stickers we give them than they are worried about what's about to go on. I work with a really awesome surgical team, so I'm very lucky that your child is going to be in great hands. After surgery, they're going to be brought into the recovery area where you will meet them. They'll probably be a little sleepy or a little drowsy. Some children wake up with something called emergence delirium where they are angry and fighting, but luckily they're not going to remember anything. That's just like when they throw a little bit of a tantrum at home. But that normally lasts a very short period of time, and then they're going to start waking up a little bit more. They'll become a little less drowsy. They'll eat and drink a little bit of something that's a little easy on the stomach, like maybe a little bit of apple juice, drink some milk, maybe have a popsicle. And then once they're fully awake and moving around, breathing well on their own, eating and drinking okay, they'll be able to go home with you. It's really not a very long process, and they feel pretty well afterwards. After surgery, I'm going to send you home with a little bottle with some ear drops in them. Those drops, you're going to put 4 drops into each ear twice daily for 5 days. And those drops are going to help prevent additional drainage from coming out of the ear and prevent and treat any sort of infection that may be going on in the ears. After those 5 days, hang on to those drops because you may need them in the future. After surgery, your child can get right into the bathtub. They can swim as long as it's a chlorinated pool or clean city water. We want to make sure that your child is wearing earplugs anytime they're in dirty water. And that's going to be for as long as they have ear tubes. As long as they have ear tubes, I want them wearing earplugs anytime they're in dirty water. So that means rivers, lakes, oceans, any untreated water. It's fine for swim lessons if they're in a chlorinated pool or a clean pool. You don't need to wear earplugs. Studies show that there's no increased risk of infection if you don't wear earplugs in those settings. But if you're in dirty water, it's better to be on the safe side. I'll see your child 3 weeks after surgery just to make sure that those tubes look good. And then every 6 months after that, I'm going to have you come back in and we're going to take a look at those tubes to make sure that they're doing their job. And if your child has any infections afterward, just give us a call. We'd be happy to see them. You'll know that they have an infection because they'll have yellow smelly drainage coming out of their ears, and usually we'll give you some drops to use. They'll use those for about a week and it clears up the infection pretty quickly. If it doesn't clear up the infection quickly, we'll have you come back and sometimes we'll take a culture to figure out what exactly is going on, and perhaps that infection is resistant to the drops. That's pretty rare. Most kids get get better very quickly after using some drops. And honestly, most kids don't even get infections after ear tubes. They normally do a pretty good job of aerating that middle ear so that they can hear better, and they're getting less ear infections. I hope that that helps you and that you're feeling a little bit more comfortable before your surgery. Feel free to call us anytime if you have any questions. I'm Dr. Madeleine Herman with St. Houston. Feel free to call us at 833-SENT-MD. Have a good day. Bye-bye. Schedule your consultation with one of us doctors here at St. Houston, and we'd be happy to help you.